Welcome to the show. For this episode of TAC Tic Talk, I'm Dr. Joe Bush, editor of the American Chiropractor magazine, along with Jacqueline Toussaint, publisher. Today, we are joined by Dr. Jane Brewer of Precision Chiropractic and Claude with CareCredit. Welcome to the show.
Thank you for having us.
Absolutely. We're very excited. So, as we were just chatting a little bit, I was talking to Dr. Brewer, Dr. Jane. Now, you're located in Colorado, but your practice is pretty unique in the way that you deliver care. Can you tell us a bit about the type of practice you have?
Absolutely. I am an upper cervical specialist, and that means I really look to the junction of the head and the neck and restoring structural neurological balance in that area. It's a small area, but it's a very vital area. It plays a huge role in our overall ability to maintain balance, postural control, movement, blood flow. And so it's not often we look at the foundation of something at the top, but when we look at the structure of our spine and how it's built and how our bodies are wired, it makes sense that if your head's not sitting on top of your neck straight, that everything else is going to be compromised after that. So it's just a bit of a different way of looking at things.
No, I've always been fascinated with the upper cervical approach. Now, what was your background? Because you don't just open up a clinic doing upper cervical. So how did you get to the point where you felt confident and comfortable in your administration of care? And can you talk about that a little bit?
I can. And I guess, I don't know if that I'm the anomaly, but I did actually open up a clinic practicing upper cervical right out of the gate. I was very influenced by upper cervical while I was a chiropractic student. It made sense to me as a model of care that, the area that we focus on, which really is as close to the brain as we can get when it comes to the spine, that there was a method of analysis there, that it was very precise, delicate, calculated work, and there was a system to know when that person in front of you needed to be adjusted, but then there was also a system to know when that person did not need to be adjusted. So that really appealed to me right away as a student. And so I knew that's the type of practice that I wanted to have right out of the gate. And my husband and I, we moved to Atlanta so I can go to chiropractic school. And we always knew that Colorado was home, so we figured we'd come back. I was not built for summers in the South. I'm a mountain person. But there was nobody else practicing upper cervical in this area at that time. And I knew that if this is what I wanted to do, that I was going to have to just, tighten up my bootstraps and make it happen. So that's what I did.
So how does this approach naturally guide patients towards wellness care?
That's a great question. I think it naturally does so because if we're doing everything right, if I'm delivering great patient care and we are monitoring their progress as we go along, what should happen is somebody should need less and less of me as time goes on. That's a sign that things are healing. That's a sign that things are growing stronger and becoming more stable. And that, of course, comes with a body's ability to function better. Functioning better leads to feeling better. And once people start to feel better, they realize that they want to keep it that way for as long as they possibly can, and that it doesn't really require as much effort to keep things happy as it does to elevate.
No, that's outstanding. Claude, how does CareCredit, how can they help patients when they're, they want to continue with this wellness care? Is there a way that CareCredit's been able to kind of integrate with the clinics, or how does CareCredit fit into the grand scheme of things when talking about patient care?
Absolutely. So, in part, it's really us, CareCredit, understanding what the chiropractors are trying to accomplish, as well as the patient. And with the variety of treatments that are out there, we have to remain flexible in the offerings that exist for patients. As Dr. Brewer mentioned, some patients who really commit to ongoing plans, and they schedule their adjustments in advance, are typically more committed to the service and treatment. And one of the things that we have learned about through the chiropractic space is that many people don't go in for just one treatment. They go in for a series of treatments, and those treatments can go, all up to 90 days. So in recognizing this value, we, with the CareCredit card, we now allow patients to be able to pay for their services and treatments in advance, up to 90 days. And this is going to help to the patients or clients to commit to the ongoing care with CareCredit.
Oh, that's great.
Well, I totally understand that because I'm a chiropractor and I'm seeing patients, and we actually do that. It's like we
That's
have
great.
to you have to tell them what they're going to do, right? It's not like a magical thing, right? I mean, some of the results
Mhm.
are really magical, but if you want that long term improvement, like Dr. Jane, you've been experiencing, can you talk about some of like these cases that you've had, you know, on any of these topics? I know there's a lot of people in the audience right now that are thinking, I've always been interested in the upper cervical approach, but I've never really taken the leap. Can you share some of the great results that you've had in administration of care, and even, how maybe CareCredit has been able to integrate?
For sure. Yeah, I'd be happy to. That's why we do what we do, right? Is to
Mhm.
see those results and just witness the improvements in the quality of lives of our patients. Like that's what fires me up to come to work every day. But in the upper cervical landscape, we take care of people, with what you would think to see a chiropractor for, neck or back pain. Those folks do great under upper
Mhm.
cervical care. But I feel like my real passion and my expertise really lies in caring for folks with migraines. We take care of a lot of people post concussion who haven't seen recovery in a reasonable amount of time. We take care of a lot of folks with vertigo and all of the conditions that may cause vertigo, dizziness, unsteadiness. And those people are often profoundly affected in their day-to-day lives, and it's a huge win when the answer could be that the one little bone at the top of their neck just is not positioned correctly, and all it takes is a very calculated adjustment, and then that ongoing care, like you said, Dr. Joe, it just takes some time and repetition to create stability there.
Mhm.
And as far as CareCredit is concerned, we always offer that to our patients as a payment option. I think it's just a nice way for folks to just access care, like you mentioned. That so it's always an option that we offer our patients. But the results they really speak for themselves, and I think it's the difference of customizing the care for the individual, customizing the adjustment. We're literally getting in there and measuring down to the hundredth of a decimal place, like how C1, that atlas has shifted, and we craft an adjustment that is for that person's body. And it can often be quite underwhelming. It's a very gentle adjustment, it's a very calculated adjustment. And so it's
So
surprising for people
you're
sometimes.
not just feeling up in the neck, or are you doing what kind of tests are you doing so that I mean, because if you're making it that precise,
Yeah. And so we had always, upper cervical has always relied on image guided adjusting.
Mhm.
So we have come out of x-ray. I finished the upper cervical diplomate program in 2022, learned a lot about cone beam CT. So that's imaging that we have kind of brought out of the dental world, and are learning a lot more about it in the upper cervical world. It gives us these magnificent 3D images that give us the clarity of how those joints are articulating, the asymmetry that is always, always present in the spine. Like we are asymmetrical beings by nature. So oftentimes, of course, we palpate the spine, we feel how things feel. But sometimes what we're feeling is just because the bone is formed differently on the left side versus the right side. So it's important to know that. So we rely really heavily on that 3D imaging. We
That
do a
sounds
ton of other.
fantastic. Cone beam CT. Do you have one in your clinic, or is
I
this like,
do.
wow, that is a
I
serious piece
do.
of equipment too. So okay, like that's definitely something that you want to have done, right? So, but is it? I mean, is that something that is that's got to be a cash service that you're doing at that point, or
It is. I mean, I to be honest, my practice has never been in network with insurance companies, so I'm not sure how that works. We do furnish our patients with the documentation they need to get reimbursed if they do have out of network chiropractic benefits available to them. We know
right?
we've been taught how to code it properly, and I do believe that for some patients, they are able, if they do have the benefits available to them, to be reimbursed for that type of imaging.
Hmm.
It's honestly, when you look at the radiation exposure charts, and I've done a lot of research and deep dive into the literature, it's actually ends up being less exposure than a what would we would typically shoot as a 5U cervical series in an upper cervical world. So it's better image quality with less exposure to the patient.
That's fantastic, man. I so so you're able to get the real the amount of force necessary, the force depth, right? And so it's
Yeah.
kind of
And so
uneventful.
the images allow us to understand, which side to adjust somebody on, which angle to approach that at,
Mhm.
like you said, how much force to use, how much depth to use. We also factor in a lot of other diagnostics that we do. We use an amazing technology called neck care. It allows us to really quantify and teach patients about their range of motion, about joint position error. So how well are those proprioceptive joints in the neck communicating with the brain? We test sensory motor control. We do a lot of balance or cranial nerve testing as we need to. I just want to get a really clear clinical picture of what that person in front of me needs so that we can make the best recommendations to improve our outcomes. That's really what it's all about.
That sounds fantastic. Now, Claude, we've been seeing you around for a while. CareCredit has definitely an important role to do with Dr. Brewer's clinic there. But what kind of trends have you seen over across the chiropractic prevention with regards to their overall patients' overall wellness strategy? Is this something that you see across the people that you interact with as well that are using your services?
Well, the biggest thing right now that is that patients are focused on is cost. Cost can be an inhibitor to getting the care, and as these routine cares add up, many people will postpone the care, and that can have a tremendous impact on patients. And it can cause other types of symptoms that they may have to address down the road if they don't get the care. So for us, it's really important to work with the chiro practices to ensure that we can take the financial solutions and options that we have and bring those forth so patients are really focused on the outcomes and not worried so much about how they're going to be able to pay for the care. So this has been really addressed in a lot of research that we've done. I'll give you a couple examples of that. We had a survey done in 2023 with the company Kantar US Monitor Research. 46% of patients said that they would go to the doctor or go to a chiropractor if it didn't cost so much. Another survey that we showed that 62% of the consumers surveyed do online research before they actually looking into cost and care and cost and fees before they actually figure out where they're going to go, whether it's in network or out of network. And then lastly, in 2023, our Healthcare Journal Research survey studies revealed that 53% of patients they said they would delay or their health and wellness care due to out-of-pocket costs. And the good news is that CareCredit is a win-win in the sense that we actually offer options for patients to be able to offset some of those concerns that they have and to be able to pay for that over time. In addition, it helps the providers to be able to increase their revenue by having more patients come in, get the procedure. So we work very, very closely with our partners and providers in our network to be able to support their needs.
And Claude, I wanted to jump in too because I remember when I was preparing for this, and it's funny because using the terms about what the patients need, but what I understand a lot is too in chiropractic and where our strength is always in this preventive care. And so people are always looking to chiropractors as more of a preventive, and so they have a hard time wrapping their head around investing in their health when it adds up. And so I didn't really realize that with CareCredit that what you guys are doing is it's simply a payment method where now, like from I understand from, and Dr. Joe, who's my brother as well, and Dr. Jane, you're a family chiropractor as well. Prepayments are kind of the lifeblood, the financial lifeblood of any good business. And so it's funny when you get a patient now who gets to see their care plan up front and saying, maybe I have migraines, and sure, every day they'll go and buy, drugs that they need to manage that pain. But if they can't go to a chiropractor every single day, like a drug, well, then they don't view it as a need. This is like a luxury. So I
Right.
didn't realize that really this is where your guys' strength has been. So the chiropractor or the patient isn't actually having to think of that lump sum because out of their pocket, they're paying it over time. And that's something that I thought was, if you want to elaborate a little bit more, but did I because I understood that was a big factor too, is that insurance is more of a need base, like what they need at the last minute once everything's all the
So they
wheels are
don't
off.
die, right? Or
Yeah,
miss.
yeah. When that's considered need-based
Yeah,
care,
it's
right? Like
like the
when they're
last
at their last
option.
leg. But when they want it is when they're like,
Well, when they
they
know
need.
they need it, but the insurance company doesn't think they need it. That's my
Yeah.
opinion. That's totally my opinion. But I mean, the truth is, you're doing God's work here because the chiropractors already invested, 10, 15 years in their education, all their equipment. they got their things they got to pay for. The patient doesn't understand that. They just have this new symptom, which may be something that will lead them to like dementia early onset, which they haven't proven
Mhm.
yet. I mean, there's a lot of stuff going on when these symptoms that Dr. Jane's treating, and I mean, the studies just haven't perpetuated yet, right? So it's the knowledge is still being understood. I just think it's
Well,
fantastic.
yeah,
So
I think that's really amazing that you guys at CareCredit found a way to get that prepay to get the cash practice where it's kind of working for both the patient and the chiropractors as well, so that they do what's preventive care, investing in the best solution instead of having to save up over time and then, being left for what's left in in some worst case scenarios there.
Absolutely, and you know what, the main part is listening to and hearing the voice of our providers and understanding the landscape and how things are changing. 3 years ago, we did not have the ability, or we did not utilize the ability of being able to offer 90 days for those package or those services, but those are needed. Those are critical for patients that where they come in, they're not going to heal in a one-time scenario, but they need multiple treatments. And having the ability to be able to pay for that over a period of time is certainly going to help them. And at the end of the day, it helps the overall experience. The treatments that you all are providing, the comfort and care, as well as being able to pay for this treatment and not delay it and pay for it over time,
Mhm,
is really essential to that experience. And it's only going to help practices because that patient walks away with a great experience.
mhm.
wow. So just wanted to get back to the technique a little bit, Dr. Jane. You mentioned about the awesome imaging that you have. I mean, I've never even quoted a cone beam CT, so I'm like a little interested in that, but that's a different conversation. What kind of structural changes do you see with this type of technique and approach? And do you have any
Yeah,
real
and so
examples of like, working on the concussion type, like hockey patients or anything like that, or any other examples you could provide?
for sure. And I wish I could just show you all of this. It's such a visual experience. But with upper cervical, we always do pre and post imaging. So we're looking and measuring and remeasuring to make sure that the adjustment did what it set out to do. And, just like we have a range of normal for our blood pressure or our body temperature, how much air should go in the tires in our car, there's a range of normal for what spinal alignment should be, right? When we look at the spine from the back, we don't want to see any curvature there. When we look at the spine from the side, it should have, the neck should have that natural curve. And when we start to depart from that normal structure, that can then lead to alterations in biomechanics, right? The neck's not going to move well, so it's not going to feel good. It can influence the neural pathways. That's going to lead to dysfunction. It's not often talked about, but it can also influence blood flow to and from the head. It can also influence the circulation of cerebrospinal fluid, which is so critically important in keeping those neural tissues healthy, nourished, and free of metabolic waste products. And so a tiny little misalignment here can have a really global impact. And so when we make that adjustment, we're always doing pre and post imaging, and we will often see over time, the spine correct, and we can measure that. We can see, an atlas that
Mhm.
was high on the right side will start to level out. And then when we look at the curvatures in the neck, when we look from the side, that lateral view, right, we want to see that natural lordosis in the neck. And we all often see when the head's sitting better over top of the neck, it's just going to start to improve. And the goal isn't to make a pretty picture. The goal is to help that person regain function and help them feel better. And oftentimes that's a natural byproduct of what we
Mhm.
do.
Mhm.
Very good, very good. So, what are some of the objections that you've had with your patients? When you're presenting your plans. I mean, obviously, is it a time commitment? How often do they have to come in? The financial, I imagine, are pretty substantial too. Can you
Yeah.
talk on those points?
I would say as chiropractors, those are probably the questions we all get, regardless of technique. What's it
Mhm.
gonna? Can you help me? First of all, like the person in
Right.
front of you wants to know, can you help me? How much is it gonna cost, and how much time is it gonna take? So I think those are probably the top three. We do our best to just try to answer those questions before they're even asked, because we know they're
Mhm.
coming at us anyways, right? And so, first of all, if somebody doesn't have a problem that I believe I can help them with, I'm going to tell them that right out of the gate.
Hmm.
But if they do, then, and we do decide to go down the path of investigating, and, I look at our exam process like we go on a fact finding mission. We just collect a bunch of information to understand how we can help that person. And we also are really transparent about our fees up front. So I would say, yeah, those are the most common objections. And
Hmm.
I think also, in general, we have become a very instant gratification society. Like, we literally carry around these little like computers in our pocket. We can get all the information and answers we need literally in an instant. And I'm just as guilty as everybody else. When my body doesn't feel its best, I want it to feel better like yesterday, not
Right.
weeks from now. But people have to understand that oftentimes the issues that they're dealing with today didn't happen overnight. It was a progressive thing that developed over time. It's going to take a little bit of time and effort to dedicate to the healing process and hopefully correcting the underlying cause of what's happening instead of just putting another band-aid on the problem. And yeah, then of course it is the finances, which is why it's really good to be transparent about that right out of the gate. We disclose all of our fees in a complimentary consult to our patients so that there's never any surprises. And like Claude has said, we want to give patients options.
No, that's perfect. Now, Claude, how are patients approaching the financing of their preventative health care differently today versus maybe in the past?
Well, today there's a lot more consumerism involved with their decisioning, whether it's in network or out of network. Many patients will do their research before they even enter into a practice to understand, some of the cost associated with that, because it's very important to them, and how they're going to be able to pay. And equally as important is within CareCredit, we also try to equip our provider partners with information on how to offer CareCredit and at what time, and when they're having that financial conversation, to be able to explain to patients how the financing works. We've even taken that a step further. We have what we call our fair financing principles, which is a web page that is geared towards both our providers and our patients to really help educate them on how to leverage financing. We have tools on there so patients can start compartmentalizing. If they have an unexpected expense related to their chiropractic care and they have to be able to manage that in their budgets, there's tools out there that will help those patients be able to understand how they can be able to fit that in their budget. Plus, with our promotional financing, they're able to pay for that over time and essentially be able to get the care. So we do a lot of different engagements to ensure that, one, the providers are educated, but also the patients are educated on the different options they have.
Claude, where is that calculator? Is there a calculator online that you're talking about there?
Yeah, if you go out to carecredit.com, our providers can access that, and as well as our patients. But it's a wonderful tool that enables both to be able to become further educated on some of the financial options and
It's
financing.
wild being a chiropractor because you've got to be this business person. You want to help everyone. You've got this technique that will help everyone potentially. You have to pay the bills, and then you got people coming in with their own stuff. They got horrible symptoms, and then you got to figure out how to get them care and keep your doors open and all this stuff. And I mean, it's like the Julia Roberts Rodeo Drive thing sometimes, it's like I don't know if this person can afford the care. So having something, an alternative, so that they can be transparent and you can be transparent with them is so important. But
Mhm.
I mean, definitely. I mean,
Well,
Dr. Jane, do you ever feel like that? I mean, I don't know. That's how I feel sometimes. Where it's like, oh, this person's going to need their insurance. They want their insurance. Their insurance isn't going to cover it. We know that because maybe just of the nature of how they're coming in. That's how I feel. I think.
I know, I don't, maybe I just have a simple mind. When the person's in my office in front of me, like, I'm just here to serve them. And I try to take all of that finance stuff out of my head and really just focus on the task at hand. My staff is incredible. They're often the ones in the room with those patients having those conversations. But I think that's the beauty of what we do is we really get to look at the person in front of us and, as a clinician, work together to do what is truly best for them in that moment, and you just put that information out there. You empower them to be educated about what's happening, and you give them permission to make whatever choice is best for them. And I feel like that's the best thing I could do for somebody.
That sounds like a great way to stay focused on the task. Claude, do you guys interface a lot with the administration or back office of clinics then? Do you have some good onboarding approach for those clinics?
Absolutely. That is critical to what we do within CareCredit. So any provider that joins our network will have to go through a certification and training process. And what that enables is to really understand how to offer CareCredit, how to process an application, how to complete a transaction, and all of the regulatory things that are involved with that in terms of providing the applicant with the proper disclosures and transparency documentation. So that is critical for us, and that's not just at the time of onboarding, but that is something that we consistently do throughout the relationship with our providers. As you know, many administrators come and go, and so it's important for us to continue to have that training within the practices to ensure that the individuals or the administrators that are actually communicating with the patient and talking to them about financial options are well equipped to be able to effectively and compliantly give them their financial options to help them make the best decision they can make.
Claude, are these services available in all the United States or just specific area?
Yes, it's all U.S. based, so we have um, chiropractors all over the United States, and it's we have heavy concentrations in certain markets.
Mm-hmm. I wanted to jump in and add something too, and this is kind of a loaded question, Dr. Jane. It's
Oh
about
no.
this is one. I mean, do your patients ever take a break from care and then return? And then what do they typically report as to why they left and why they return?
Yeah, of course they do. I don't think that's a loaded question. I think we're all humans and we have busy lives, and we have times where we go through life where our finances are tighter than others. We have life changes. People start families. People have deaths in the family. Like, there are so many reasons why patients might take a break from care. And I think that's natural. And I think the best thing we can do as providers is to give them a little bit of grace. I mean, we do the same thing for our own care too, whether it's chiropractic or otherwise. I love getting massage therapy, but I haven't seen my massage therapist in probably like 6 months. Life just gets busy sometimes. And the best thing that we could do is welcome them back with open arms. Cause like sometimes there's got to be just a level of like, just maybe feeling a little bit of embarrassment, like, oh, I didn't take the best care of myself that I knew how to do. But we never want somebody to feel that way. And so we welcome them back. When people leave my practice, even just on a routine basis, I just, or when we finish a specific phase of care, I even say something. I'm like, you know what? If you need to take a break, just tell me, and it's okay. The door is going to be open for you when you want to come back. But if you don't tell me, I'm going to think you just fell off the edge of the earth and like something's happened. But I'd rather know that somebody's going to take a pause for a while, and also just let them know it's okay. And I try to encourage people, please don't, you made this investment in your health already to make all this progress. It's so much easier to protect the gains you've made. Don't wait to come back until it gets bad again. But if they do, we're going to love on them and care for them anyways.
Mm-hmm.
I think that's great advice to follow.
But I wanted to find out, Dr. Joe. Now, the follow up to that, of course, is Claude. What would you say? How does the care credit prepayment say that the patient is prepaid for something and now they've stopped coming in for a while? How does that affect their relationship? What is the solution? I guess the care credit has found for that.
Yeah, so if a patient decides for whatever reason that they are no longer going to get care, it's important for every practice to have a sound refund policy, because again, those monies are for services that are rendered or going to be rendered within uh, the 90 day period of the initial purchase. So it's critical that we treat those patients in a way that we're refunding those outstanding balances of the services that aren't rendered. The one thing we don't want to have happen is a customer is getting billed by CareCredit and they haven't received the services or the treatment plans that they expected, because that's going to lead to customer complaints, potentially customer disputes, and none of us want that. We want to make sure that we're taking care of those patients and or cardholders to the best of our ability. So it's essential that we work together to ensure that if a patient decides that they no longer are going to receive care or postpone it for a temporary period, we are able to refund them the unused portion of that back to the CareCredit credit card.
Mm-hmm. Mm-hmm. And then I guess, Dr. Joe, I don't know if you wanted to pick up from there, but I was thinking too, I'm not sure if we've already covered too, and some of the typical objections that the patients might have in deciding not to go through with care. How do you address those concerns? Dr. Jane, I think that one's to you.
Oh, sorry. I thought you said Dr. Joe. Um, I think the conversation is different if we're talking about like more preventative care, like we are discussing here, or if it's just a brand new patient just starting out in the practice. But since we're focused more on sort of the proactive preventative side of things, I think the biggest thing is when people reach that point, they're like, I feel great. And we slip back into that symptom based or pain based model that we're accustomed to. And it's like, well, I'll call you if it hurts again. And I
Mm-hmm.
think maybe in those moments they've lost sight of the why, right? And there's so many metaphors out there to explain. It's I grew up playing music, and you don't just tune your guitar or your piano once and expect it to stay in tune forever.
Mm-hmm.
You use it just like we use our bodies. I live in Colorado. We have a really active lifestyle here. We live in the mountains for a reason, and we have wear and tear no matter what we're doing. And I think even though we feel good sometimes, we want to prevent those things. And I think that's the abstract thing about what we do, right? For any preventative care, we are caring for ourselves now to hopefully prevent future issues down the road. And that's a hard thing to measure, right? We can't measure what's not going to happen because we took the time to take care of ourselves today. So there's just got to be that education behind why it's so important that even when we're feeling good, sometimes it's still important to keep that keep your body tuned up.
Mm-hmm.
Perfect example. So we're getting kind of late here, but I did want to just wrap it up a little bit with one final question. Looking ahead, what do you both see as the future of preventive chiropractic care? How can practices prepare? Jane, do you have thoughts on that, or I mean, you kind of
Sure.
covered a lot of that already, probably. But do you see any innovations or anything that are coming forth?
Gosh, I don't know about innovations, but I think, coming like we're living in like the post-COVID world, right? And I think that the pandemic taught us a lot about why it's really important to create that foundation of health, right? I think, if you look back, I read a lot of the writings of BJ Palmer, who was really the developer of chiropractic. And, he called it a cumulative constructive survival value. Now that's a lot to kind of unpack there, but really I look at the more we invest in caring for ourselves now, it is like you're putting money in a savings account. You're banking that money for a rainy day, and when something happens, like I crash my skis or I slip on the ice or I go on a hike and something happens and I have to make a withdrawal from that account, I'm not putting myself in overdraft. And I think that is hopefully one of the ways of thinking that has been elevated after we saw so many people that went into the pandemic with poorer health have worse outcomes. That hopefully that was eye-opening for folks, that it really is all we have. Health is wealth. All we have is that, and without your health, everything else in your life is compromised. So that really is, I think, one of the best investments we can make is in caring for ourselves, because then we can, just go out and do the things we love and be active participants in our community and care for others.
Mm-hmm.
Great point. Now, Claude, do you have any thoughts on making preventive care more accessible as a close here?
Yeah, absolutely. I think from a financial solution perspective, it is my desire to ensure that we get as many folks that are applying for financing approved as we possibly can. So we look at what we call multiple source financing, or MSF, which allows us to get more applicants approved. And more applicants approved means more clients and more patients and potentially more revenue for the practices, and that's extremely important. We don't want anyone walking away from getting care. That we have to find the right solutions for them. So multi-source financing is going to become more prominent in the chiropractic space to ensure that we're getting more people approved and converting them into clients and patients. So I'm excited about being able to commercialize that in the marketplace, and see how that is enabling or helping practices to drive more patients, drive more revenue.
Fantastic. Now, are there any more resources, Claude, that anyone out there may be able to access to learn more about CareCredit, or what there is to offer a chiropractic clinic if they're just learning about your services or have thought about it before? Where can they access that information?
Sure, they can go to www.carecredit.com. We do have a link that's specific for chiropractic. So if they're interested in learning more about what we offer, the products we offer, capabilities, etc., they can go onto our website and learn more. There's also links if they're interested in enrolling, or if they have questions that they want to actually speak to one of our account managers. They can send the link, and then they will reach back out to them within 48 hours. So plenty of ways to learn more about CareCredit.
www.carecredit.com, right? Right. Okay. Perfect. And Dr. Jane, now you also, what was the technique that you're doing? I believe that you have some important kind of position with that technique. We were talking a little bit about it earlier. What are you doing with it? Because it's a cool, I mean, it's a cool idea. Is it Atlas orthogonal?
So it's orthospinology. So
Okay.
underneath the upper
Okay.
cervical umbrella, there's a bunch of
Orthospinology.
different techniques. We're kind of a cousin of Atlas orthogonal, and there's,
Okay.
there's Nuka, there's Blair, there's knee chest. There's a bunch of different techniques. The one I utilize is called orthospinology. So I serve on that board, and I also serve on the board of directors of the ICA's Council on Upper Cervical Care. So that is kind of a council that oversees bringing together all these techniques so we can learn from each other too.
Mhm.
Very cool. And what's your website for your clinic there, Dr. Jane?
My clinic's website is precisionchiroco.com.
Very good. Very good. Any final words? Anything that we can add here, Jacqueline?
I wanted to just add in because first off, I want to say thank you guys both for being on the show today. And especially, I mean, Dr. Jane being, an amazing chiropractor. Thank you for introducing us. And also, Claude, on behalf of Care Credit there, I often say, in the chiropractic world, we've always got this cash versus the insurance companies. And we always like to take a stance that there's no enemies. When you've got a dire surgery and need, you're really thankful for that insurance coverage. But I always have been saying, Care Credit being in the chiropractic world for us, you're like everybody's best friend. Because so I'm just saying,
Yeah, right. We all need
and
that.
you're actually interested in chiropractic and supporting people getting preventive wellness chiropractic care. So, I mean, for us, it's a really great opportunity to see such an amazing company investing in chiropractors and chiropractic care. So, thank you for being our guest today. And thank you for all the great work that you do in chiropractic. Of course, both of you. But, Claude, without people like you, it makes it really hard for all of the chiropractors clinics and their patients who otherwise would spend more on their car maintenance than they would on their own body maintenance. So really, thanks so much for all
Very
you
well.
guys do to keep
Thank
chiropractic
you.
so affordable.
Well, on that note, we're going to close this episode. Thank you for listening to everyone out there. Be sure to give us a like on the podcast or whatever. Give us a 5-star rating. Look for these ads in the American Chiropractor magazine if you want to learn more about CareCredit, or go to their website. Until next time.